Know all about insomnia. Insomnia, a sleep disorder that affects millions of people worldwide, is characterized by difficulty falling asleep or frequent awakenings during the night. This can lead to severe fatigue, mood swings and other debilitating symptoms which can have a profound impact on an individual's life. Definition of word insomnia. Insomnia is a common sleep disorder that affects millions of people worldwide. It is defined as difficulty falling asleep or staying asleep, despite having the opportunity to do so. People with insomnia often experience fatigue, irritability, and difficulty concentrating during the day due to a lack of quality sleep. In fact, research indicates that those with insomnia are more likely to suffer from other medical conditions such as depression and anxiety. Causes of insomnia. Medical conditions like depression, anxiety, chronic pain syndromes such as arthritis and fibromyalgia, as well as other sleep disorders like sleep apnea and narcolepsy can cause insomnia. Lifestyle choices such as drinking caffeine late in the day, exercising too close to bedtime or sleeping in an environment that is not conducive for restful sleep can all contribute to insomnia. Other environmental factors such as noise levels from outside sources or lights from electronics can disrupt our natural circadian rhythms, resulting in difficulty falling asleep and staying asleep. Symptoms of insomnia. Symptoms of insomnia include difficulty falling asleep, waking up several times throughout the night, waking up very early in the morning and not being able to fall back asleep. Other symptoms also are feeling unrested after sleeping, irritability during the day due to lack of sleep, fatigue during the day due to lack of sleep, inability to concentrate due to lack of sleep. These symptoms can have a significant impact on an individual's daily life as they often lead to decreased productivity at work or school and impaired cognitive performance in tasks. Chronic insomnia can also increase the risk for developing mental health disorders such as depression and anxiety. Treatment options for insomnia. Cognitive behavioral therapy, CBT, is one of the most common treatments for insomnia as it helps individuals learn how to better manage their sleep patterns. This type of therapy generally involves relaxation techniques, such as progressive muscle relaxation and mindfulness meditation, along with developing good habits around sleeping. CBT encourages people to avoid looking at screens within 2 hours of bedtime, create a consistent sleep schedule, and remove any distractions from the bedroom so that they can focus on sleeping. In addition to CBT, medications can also be used to treat insomnia. These include prescription or over-the-counter drugs like melatonin, herbal supplements such as valerian root. Insomnia's impact on health and well-being. Insomnia can have an incredibly detrimental effect on a person's health and well-being. Despite not getting enough sleep, insomniacs may still feel like they are functioning during the day, but this is typically due to their body's ability to adjust. In the long term, however, insomnia has been linked to an increased risk of physical health issues such as obesity, diabetes, heart disease and stroke. Furthermore, mental health conditions such as depression and anxiety tend to be more prevalent among those suffering from insomnia. On a more immediate level, those who are not getting enough sleep will often experience decreased alertness and concentration levels which can affect their performance at work or school. The lack of sleep can also lead to problems with memory loss or result in impaired judgment. Conclusion: Understanding insomnia. It is now clear that insomnia is not a disease, but rather a symptom of an underlying issue or condition. The root cause may be related to stress, environmental factors, lifestyle choices, or medical issues. Treatment options vary depending on the type and severity of the underlying problem. However, there are several approaches that have proven successful in reducing symptoms and improving sleep quality. It is also important to remember that lifestyle changes can make a significant difference. Additionally, practicing relaxation techniques such as yoga or meditation before bedtime may help alleviate stress-related insomnia issues.